Hi, it's Bob Boross, and this is my Jazz and Tap Dance Life. I'm here checking in with another update on my total knee replacement of my left knee. It's been a couple weeks since I've done the last update, and that's only because there hasn't been anything particularly unusual that's happened. It's just been a very steady but very slow improvement in the flexibility, in the range of movement, and just in the strength of the joint. So I took a little time off, and I'll just check in today. Right now I'm at 45 days after the surgery. So it's 6 weeks and 3 days that I'm at right now. I can say that overall from the last check-in, it's getting better. It's getting stronger. I do have much more flexibility in the joint. The last time with my therapist that she measured, which was maybe about a week ago, I guess about a week ago, it was 110 degrees of flexion, which is pretty good. So to be at 6 weeks or so, usually they say you want to be 120 by the end of 8 weeks. So I'm definitely on target, and things are looking good in that nature. The interesting thing is, even though the knee will bend that far, it like resists and hurts during that entire time that it's bending. So there is no freedom in the joint. You know, it bends, but it's telling you this hurts, this hurts, this hurts the entire time. A lot of it is that quadriceps muscle group, and it is just not giving up. It's staying tight. It's staying, kind of in a clamp sort of feeling over the top of my kneecap. And so that's what I'm dealing with right now. So let's just take a quick look at this knee, and we'll come right over here. So if I can get back out a little bit, hopefully you can see both knees. They are like almost the same size, pretty close to it. There's puffiness around the knee, which this one does not have, but the size of it is really about the same. So let's go in a little bit. I still have on the bottom part right in here, numbness. There's not much feeling in there. This side a little bit better, but not on the outside. And in here, this is where the real stiffness is. So I think at the top of the quad coming down, it's hard, it's lumpy, especially right there. There's a good sized lump there. There's a good sized lump right in here and in here. This not so much on the inside. So actually it's the outside that's giving more problem than the inside right now. But I do massage this quite a bit, as much as I can. I am still icing this joint and trying to keep the swelling down, and I'm still on the Celebrex that I talked about in my last update from there. So that's kind of where it looks now. It seems to look better. I am definitely stronger. I can walk much better. The joint itself feels very stable. So when I walk, the way my weight descends into my foot is very strong. It's just the flexibility that it does not want to give, and it's in that quadricep that's giving me a little problem right now. So hopefully that's going to get a little bit better. I've been looking up some other videos online from some other people who posted, and they're saying, that first 6 weeks is your tough time, and then week 6 to 12 is where you should be sort of getting out of the pain, getting out of the lack of flexibility, and getting into a little bit more normal movement. So hopefully that's going to come from there. I know that as I'm doing my physical therapy, definitely she's increasing the weights on all I'm using. I'll do the leg press, I'll do leg curls. I have to do stand on one leg, so I stand on that one leg for a minute. When I first started out, I could not even pick my right foot up off the floor because I couldn't put my full weight on the left. Now I can pick my right foot completely up to like a passe position and take my hands off and just balance on one leg. So it's definitely stronger in that way. So things are good, but it's still, the other aspect of it that you want to have happen is not coming across right now, okay? I'm just going to quickly check my notes, what we're talking about. Exercises, dance. Oh, I'm working on a little bit more dance exercises, so I'm trying modified grand plie in second position. I can do demi plie in first position. When I get to the bottom of that grand plie position, I feel it in the knee. Although, as I've done it 3 or 4 days in a row, it does get a little bit better. Releve on that left foot was almost non-existent. Now it's getting a little bit higher. When I'm in first position, I'll do it like a double releve, press up, and I get to hold and press down. So it's just slow. It's coming about little by little. But it is definitely not in the realm of where I want it to be. I really do have to keep my knee absolutely straight when I bend. If I do any twisting or torquing, that's something that's gonna give me some problems. And I'll talk a little bit about that in terms of sleeping. Sleeping, I'm still not there. For a couple days, I thought I was doing well. I got up to almost 4.5 to 5 hours straight before I would wake up because of the knee, and then it regressed and went back. I'm thinking, and last night I tried this again because I saw this on another video, and they tell you not to do this, but put a pillow underneath your calf and to your heel and the bottom part of your knee, so it just kind of supports it and it keeps it elevated. And that does help me sleep a little bit better, so I'm going to do that a little bit more. Although constantly you're being told, do not put your knee into a bent knee position because it's going to stay in a bent knee. It's not going to be straightened. Although when I'm at therapy and she's stretching it, she's pushing down on my shin, she's saying it's getting to absolutely straight. So hopefully I should not have a problem with that. So sleep is still not the best. I do take a lot of naps. I'll conk out. Even there's been a few times this week where I just laid down and I woke up 3 hours later. Sleep is not the easiest thing. So hopefully that's going to come a little bit more. So it just brings it down to sort of a little bit of a frustration level, because you do feel that you're getting better. You do feel things are improving, but you would think, in your mind after 6 weeks, this thing is ready to go. It's ready to start moving, and it isn't. It's still going to probably take at least another 6 weeks, and then hopefully things will get a little bit better. I would like it to get better because we're coming up on September and I'm supposed to start teaching again, and I want this to be good and get back to work. So anyway, that's about it. Slow but steady improvement, but still issues, still frustration, still the sleep. But the knee does look better. Hey, I went to the beach 2 times, so I was able to walk, get onto the beach. I didn't really go in the water too much. But so I'm a little bit back to normal. When I go, I don't use the cane anymore. If I go food shopping, I have no problem. But I just have to monitor, not push it. I did kind of push it. I had a real strong therapy session last week on Thursday, went to the beach on Friday, did a lot of walking on Saturday, and by Sunday, my knee was definitely talking to me and saying, what did you do to it? So did a lot of icing after that. So hopefully I'm out of that pattern. So that's it. 45 days, 6 weeks and 3 days into this, and hopefully it's going to get better from here. Okay. So that's where I'm at. I'm Bob Boross, and this is my Jazz and Tap Dance Life. Thanks for checking in with me, and I'll be back soon with another video as soon as we have some more improvement. Okay. Thanks for watching, and we'll see you soon.